This message is from the Ministry of Health with support from partners.
My name is Dr. Alfred Yayi. I'm the Hospital Director, Jinja Regional Referral Hospital. I've served in this hospital for 2.5 years now, and I'm happy to be serving Ugandans in this hospital. Jinja Regional Referral Hospital serves the people in the East Central region of Uganda, also known as Busoga. We serve 11 districts and 1 city. That makes a total of 12 entities that refer to us, and that's a population of 4.5 million people that we are responsible for. We directly supervise 9 general hospitals in our catchment, 22 health center force, and of course the district health teams that are located within this region. The hospital started in the 1930s as a health facility for treating World War II veterans. It eventually grew into a general hospital, and in 1995, Jinja Hospital became a regional referral hospital for the people in Busoga. Our vision is to be a center of excellence for health services delivery in Busoga region. And our mission is to increase access to both general and also specialized health services for those who live in this region. And our legal mandate includes provision of health services, both general and specialized, although right now we focus more on the specialized services because we are a referral facility. So our mandate includes provision of health services. It includes training of health professionals. We have a number of partnerships with the universities and other health training institutions. They send their interns and students here, and we train them. The other aspect of our mandate is undertaking research. We undertake research either as an entity or in partnership with many other organizations, and we have a research and ethics committee to back up or support that mandate. The other mandate we have is undertaking public health services in the region. We have a regional emergency operations center that does routine surveillance in the region, and we support responses to disease outbreaks such as the Mpox. Now we have Ebola, and we have had COVID and others. So we support the region technically in terms of surveillance as well as response to these disease outbreaks. The final part of our mandate includes providing technical support to the lower level facilities. In terms of the services we provide both outpatient and inpatient services, as well as other specialized services. In the outpatients department, we run general clinics. In the general clinics, we see about 12,000 clients every month. And in the specialized clinics in the OPD, we see about 9,000 clients every month. And this is likely to grow because now we have recruited many more specialist doctors in areas where we did not have them before. And so the number of specialist services we have offered has actually increased. So that is the outpatient department. It also includes accident and emergency services that we provide there. In the inpatient services, we provide services just like other regional referrals in a number of disciplines. We have the general internal medicine. We also have other aspects of medicine such as mental health services that are available here. And then we have the surgical disciplines. Before I go to that, we have the pediatrics and child health. Now, in pediatrics and child health, what is unique with Jinja is that our pediatric department is located in another campus of the hospital. We have 2 campuses. So we have Nalufenya campus, where our pediatric department is. And in that campus, we see about 150 to 200 children every day. And we have quite a number of admissions. And we think in the future that could become a specialized children's hospital of its own because it has 80 acres of land and the clientele is really very big that we serve in there. Then we have the obstetrics and gynecology department that has its own theater, and we are able to deliver about, on average, 530 mothers every month. And we do, out of those 530, about 170 cesarean sections every month. And we have also attached to the intensive care unit where we have 11 incubators and 2 baby warmers. And the premature babies, we're able to look after them until they're mature enough to go home. Jinja Regional Referral Hospital is one of the regional referral hospitals that has built capacity to provide ICU, intensive care unit services. We thank government and the Ministry of Health and the UPDF Engineering Brigade that expanded our ICU. Now we have a 10-bed capacity intensive care unit, which is fully equipped, and we have some staff, although we need more staff, but the ICU is fully functional. We also have a big capacity oxygen plant, and with that plant, we are able to serve the entire region in terms of production and distribution of oxygen, medical oxygen, for our clients in the region. Last year, we partnered with the Uganda Heart Institute, and we provided cardiac surgery services here. We were able to operate on the hearts of 8 children. Those children had holes in their heart, and therefore they were not growing normally. So when Uganda Heart Institute team came and worked with our teams here, the operations were done in our theater. All these 8 children recovered through our intensive care unit that I talked about, and they were discharged. And they are thriving very well. We are following them in the communities, and that service will continue. This year in May, we intend to partner again with the Uganda Heart Institute to bring cardiac surgery service also here. We are already screening for those who need the service, and we'll be operating on them in May. The same way we are partnering with the Uganda Cancer Institute. We do cancer screening here to a limited extent, but our vision is in the long run, in future, to be able to have a regional cancer center here as well, and be able to not only screen, but also treat, provide chemotherapy and radiotherapy for cancer for people in our region. We also have other aspects of surgery, such as the orthopedic surgery. We provide that. We have dental surgery, ear, nose, and throat surgery. Now we have ENT surgeon. We have ophthalmology, that is eye care services. We have that unit, and we have an ophthalmologist. We also provide private wing services. We are a government or a public hospital, and that means services here are paid by government. They are free services. However, in the private wing, our clients pay for services. Those who want to pay, they go to the private wing. But the rest of the hospital, the services are free. And if anybody is asked for money for any service in the other aspects of the hospital, I think that should be reported to us as management or any member of the hospital management board. Usually we handle such cases expeditiously to make sure our clients access free services that are paid by government. But the clients who think they want to pay for the services they get, and they want to enjoy a better ambience and so on, they normally go straight to the private wing, and they pay there, and they are issued official receipts. And the non-tax revenue we generate goes to the consolidated fund before it is returned to us to provide services. So our focus now is to bring all these specialized services home so that our people can benefit. But at the moment, looking at our mandate, I think we are doing quite well. For the 2.5 years I've been here, I think we have streamlined a number of issues. We get a lot of feedback from our clients, and I think there's a lot of improvement. I think we are on course in achieving our mandate. Of course, where there are issues, where there are challenges, our offices remain open. My office is open. We have a management board. We have other government offices, like the office of the RCC, the mayor, the city clerk, and other authorities in the region. They are always able to give us feedback where there are issues. Clients can come here directly to my office or raise issues through any of those leaders, and we always are on spot to address those gaps so that we improve access to quality services for all the people in this region. That is briefly what Jinja Regional Hospital is.
You are watching the DOCtalk Show. This message is from the Ministry of Health with support from partners.
Yes, good evening, viewers. I welcome you to this talk show, supported by Ministry of Health in collaboration with Jinja Regional Hospital. And on this talk show, we are going to talk about heart diseases in children. But before that, let me introduce myself and the team I'm with here. By the name is Dr. Kibuuka Afizi. I'm a consultant physician, and I'm the head clinical service at Jinja General Hospital, and I'm the deputy hospital director at Jinja General Hospital. With me here, I'm with...
I am Dr. Agatha Namutosi. I'm an associate consultant pediatrician at Jinja Regional Referral Hospital.
Good evening, viewers. I'm Dr. Emmanuel Tenywa. I'm a consultant pediatrician and a cardiologist working at Jinja Regional Referral Hospital. You are most welcome.
Thank you. With that, our topic, we said we are going to talk about heart disease in children. Of recent, there has been an increase in the number of heart diseases amongst children in our region. And of recent, last year, even we had to hold first of its kind open cardiac surgery at Jinja General Hospital in collaboration with Uganda Heart Institute, where about 7 children were operated successfully and they are doing well. With that, we found it of interest to share with the public what are these heart disease children, what causes them, why are they there, how can we prevent them, and how can we manage patients with them. With that, I'll invite Dr. Tenywa Emmanuel, who is the cardiologist, to take us through what are these common heart diseases in children we are seeing within the region at General Hospital. Dr. Tenywa, welcome.
Thank you, Dr. Afizi. Good evening, viewers, once again. I want to talk about the heart diseases in Uganda generally. Then I'll talk about Busoga. I want to start with the congenital heart diseases. As we know, 1.6 million children are born every year in Uganda. Now, 1% of the 1.6 million children who are born in Uganda, they have a congenital heart disease. So that is 16,000 children. Okay? Now, what is very interesting, 50% of the 16,000 children, okay, need intervention. So that is 80,000. So 80,000, because now 1% of the 1.6, it is what? 16,000 children are born with heart disease. But of the 16 children who are born with heart disease, 50%, which is 8,000 children, they require intervention. Okay? Now, in the Busoga region, we deliver around 200 babies are born in the Busoga region. So if we are to use the other formula, if 200,000 children are born in the Busoga region, and we are saying 1% of them has a congenital heart disease. What is congenital heart disease? A congenital heart disease is a heart defect whereby a child is born with a heart disease at birth. Now, if Busoga region we have 200 babies who are being born per year, and 1% of that is what? 2,000. Okay, so it means 2,000 children in the Busoga region are being born with a congenital heart disease.
That means they are born with a heart problem.
With a heart problem.
Okay, fine.
Now, 50%, which is 1,000, they need intervention.
Doctor, could you clarify more? What exactly are you mean by intervention?
Intervention, it means they need treatment. Treatment can be medical or it can be surgical.
That means you are saying there are some who may not need intervention?
Yes. So I want to take us through some of the congenital heart diseases. There was a study which was done at Uganda Heart Institute. And they followed up patients for 7 years. Judith et al. And you know what they found? The commonest heart problem was a ventricular septal defect. That is, it is a hole between the two lower rooms of the heart. You know the heart has 4 chambers or rooms. There are 2 rooms up and there are 2 rooms down. Now the rooms down we call them ventricles. The rooms which are up we call them atria. Okay? Now we have the left side of the heart and the right side of the heart. Okay? Now if you have a defect or a hole in the lower chambers or ventricles, that one is a ventricular septal defect and it is the commonest we are having in Uganda. Now, the second one is what we call a patent ductus arteriosus. Okay? It is the commonest. That one is now a connection between blood vessels. It is a connection between the descending part of the aorta, but also with the pulmonary artery. That is the second. The third one on the list, I'm going to give you the commonest 5. So the third one on the list is the atrial-septal defect. Now that is, if you remember, there are 2 rooms down in the heart and there are 2 rooms up. Now, if you look at the rooms up, if there is a communication between the 2 rooms up or the atria, that one we call it an atrial-septal defect. Okay? Now, the first one which we found was tetralogy of Fallot. Tetralogy of Fallot has 4 components. Tetra means 4. So basically that baby has obstruction. There is a blood vessel that takes blood from the right side of the heart to the lungs to put oxygen. So that blood vessel is narrow. Okay? And also they have a hole in the heart. Okay? And there is what we call overriding of the aorta. I don't know how to describe it, but there is overriding. If you look at the aorta, it overrides. Because the aorta is meant to come on the left side of the heart, but now it is between the left and also the right. And the last one, the right ventricle becomes thick because of the obstruction. Okay? Yeah. So those are some of the commonest heart problems we have in
Okay, doctor,
Uganda.
those you say those are the ones you are born. Yeah? What about those on which children acquire? What are the commonest, those on which the children acquire? Because here we have got it well that there are 5 common congenital. Yeah? What about what are the common acquired? The child is born with a normal heart, then later we see develops a heart problem. Yeah, what are those ones?
Thank you so much, Dr. Afizi. So, apart from the babies who are born with heart defects, there are also children, they are born normal, but as they grow, they acquire a heart problem. They were not born with it, very normal, but as they grow, they acquire a heart problem. And the commonest is rheumatic heart disease. Rheumatic heart disease normally affects children who are between the age of 5 years and 15 years. And these are the children who are going to school. Now, how does it affect these children? Normally, these children suffer from a sore throat. The child will come to you at home, "Mommy, Daddy, I feel like I have some pain in my throat. I have like a throat infection. When I swallow, I feel pain. Mommy, I feel pain when I'm eating food, when I'm taking water." So you should pay a keen attention to that child. Don't sleep without listening to that child, because that child needs attention. If you don't treat a sore throat, that infection will go into bloodstream and it will go and affect the valves of the child. And if you don't treat it, the child will get permanent damage to the valves of the heart.
Thank you, doctor.
Then in addition, we could also have the latent cardiomyopathy, whereby the heart becomes big and weak, and this can be caused following infections like even viral infection that can attack the heart and cause the muscles of the heart to become weak, so it becomes very widened and weak to pump blood.
Okay, thank you. That means for the acquired disease, we call upon parents to listen to the children. When the children has anything like sore throat, make sure it takes as an emergency. If the child has a viral infection, make sure you take it as an emergency. Let us stop self-treatment. Let us look for information from the experts whenever these children are sick. Children they are not small adults. Children are human beings who need to be taken care of. So, in summary, we have said that heart disease in children, they are common, and mostly there are 2 types. There are those which the children acquire when they are born with a normal heart, but then they get infection as sore throat, viral infection, and the heart valves may get affected or the heart may become big. Then there are those which are acquired, those are born with. That means those ones, I don't know when the child is still young, isn't so, doctor? And those ones we have said there are 5 subtypes. Yeah. I think with that, we are going to end and go for a small commercial break. When we come back, we shall talk about what are some of the risk factors, what are some of the causes of these heart diseases, both congenital and acquired. Thank you very much.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Mali Production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quiz Mali Production, we specialize in content creation, digital media marketing, media buying and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quiz Mali Production, your partner in media excellence. Visit us at Quiz Mali and let's create something amazing together.
International Women's Day is celebrated annually on 8th March. It is a time to reflect on progress made, to call for change and to celebrate acts of courage and determination play by women. On Saturday, 8th March, Uganda will join the rest of the world to commemorate International Women's Day. The national celebrations will be held in Chankwanzi district under the theme Accelerate Action for Gender Equality. The President of the Republic of Uganda, Yoweri Kaguta Museveni, will be the chief guest. Join us for the live broadcast to witness outstanding women receive medals in recognition of their achievements and contributions to the country. Happy Women's Day.
You are watching the DOCtalk Show. This message is from the Ministry of Health with support from partners.
Welcome back from the break. And initially we had talked about the common heart disease in children. Now, during this section, we're going to talk about the risk factors and the causes of these heart diseases which we are seeing, which are increasing in the children. And for that, I will invite Dr. Agatha to take us through what are some of the risk factors and what are some of the causes of these cardiac diseases in children. Doctor, you're welcome.
Thank you very much, Dr. Afizi. We'll talk about the risk factors. What is that would predispose someone, put someone at a risk to have a child with a heart problem. So important to note is a large percentage of these, the cause is actually unknown. However, from research, from science, and what they found out as some of the common risks is maternal alcohol intake. A pregnant mother taking alcohol could predispose to having a baby born with a heart problem. And this is commonly, especially in the first 3 months of pregnancy, which is called the first trimester. It's a very critical season of a baby's development because in this season, not only the heart is developing, plus other organs, including the brain and the spinal cord, but the heart develops in the first 3 months of pregnancy. So drinking alcohol in this season could actually affect the development of the heart, and the child may end up with a congenital heart disease. The other one is ingestion of drugs, which could actually damage the development of the heart, impair the development of the heart, which we call teratogenic drugs. Examples of these are some drugs which are used in the treatment of epilepsy, like sodium valproate. And we, as doctors, as health workers, we need to be keen to, when prescribing some of these drugs for women in the age-bearing group, we should actually avoid them and give them alternatives. Sodium valproate is one of them. The other drug that has been on the increasing use is some medicine which is used to treat acne, pimples in ladies. Yeah, it's on the increase as we have a lot of beauty and cosmetology. People are using it a lot. Isotretinoin. It's a very teratogenic drug that could actually affect the child and end up giving birth to a child with a congenital heart disease. So before you buy any drug, before you prescribe, please know that they say that every woman is pregnant until proven otherwise. Please employ that and be sure that the person you're giving this drug is not pregnant or should not get pregnant in the specified period of time before the drug is cleared in the system. The other cause is folic acid deficiency, which has been found that if you're deficient of folic acid, which is a nutrient required in the development of many of these organs, the child could end up having a heart disease and some infections that could happen to the mother during pregnancy. The common one which has been identified to cause heart diseases is rubella, also known as German measles, which may not have the effect, much effect on the mother, but the baby who is growing could go on to have a congenital heart disease. So for the acquired heart problems, I will talk about diseases still, which we talked about, the sore throat, that could occur as a complication, viral infections, even infections like TB can go and affect the heart. The other thing that I've not talked about is the genetic predisposition, that in the family there is a genetic problem that causes you to give birth to a child with a congenital heart disease. If you see that this mother has had siblings, maybe brothers and sisters who have had a problem with the heart, they could as well go on to have a child with a heart problem, which is passed on through genetics. So it is important that if someone has given birth to a child with a congenital heart disease, look out for the siblings and for the children of the siblings and that child, because there could be something that is genetic in the family. Thank you very much.
Maybe I wanted to add on more too. We found out that mothers who deliver when they are more than 35 years of age, they are at risk of delivering children who have a congenital heart disease. So the other thing that we see also, the other risk factor is prematurity. Babies who are born too soon normally have a higher chance of being born with a congenital heart disease. Thank you.
Okay, thank you very much. I think to summarize all this, we have said that the causes for the acquired, for the congenital, mostly are issues like drugs. Therefore, it's upon one to avoid self-medication and also to encourage health workers to take information about which treatment people are on. Because these are common drugs. They talk about drugs of epilepsy, drugs for cosmesis, yeah? They talked about like folate deficiency. It's upon to make sure people, before they get pregnant, they have what? They take folate, yeah? In preparation for pregnancy. Then, people should deliver early, but not before the age of 18. But above 18, but less than what? Before 35 years. Because doctors told us that above 35 years, you are at risk of developing with child with a congenital disease. And know that when you have one defect, you'll have another. The kid may have more than one. So that's something maybe we need to think about. But all in all, we should avoid self-medication. We should seek expert opinion when these children are sick. We should stop buying drugs across the counter, self-medication from these pharmacies. Let us always get expert opinion, more so for the ladies who are in the reproductive age. What doctor didn't tell us, what about the man? If I'm the man and I'm on these drugs, will my wife produce a child with a congenital disease? Maybe Dr. Agatha, can you tell us something about that?
Okay. So the risk has not been shown to be passed through from the man, maybe through the sperm, but it is direct from the mother ingesting these drugs. However, it's also, there are some conditions which we call the syndromes, that children have a collection of abnormalities that they may be born with, which may include the heart as well, and they think there's some studies that show that an elderly father, fathering a child when you're elderly, could predispose them to some of these syndromes, which could as well come in with a congenital heart disease.
So this information applies also to the men, that they should avoid self-medication, and also should avoid being elderly before they deliver, probably. Yeah, I think with that, thank you very much. Then also we talked about the acquired causes. These are really key common infections which you need to avoid and need to treat them promptly. I think the issue is prompt and proper treatment of all these infections in children. Yeah? Yes, take them as emergencies.
I wanted to say something about rheumatic heart disease, more so the sore throat. These are children who are school going. As I told you, it affects children aged 5 to 15 years. And these are children who are in boarding schools. And what are the risk factors? Congestion. You see, when you go to boarding schools, they have day cars, aeration is poor. That's a high risk child. So overcrowding in schools. Okay. The other thing that is the low socio-economic status. That's why there is a parish development model, so that families become wealthy and the quality of life improves. Actually, rheumatic heart disease, which is a valvular heart disease, which is acquired because of a sore throat, untreated sore throat, is associated with low socio-economic status. So poor nutrition, okay? Even genetics, there are some families which are at a high risk of this rheumatic heart disease, okay? Recurrent upper respiratory tract infections. Whenever a child is having a recurrent upper respiratory infection, please visit the hospital immediately. Don't just say, let me just give honey, it will go away. You might be dealing with a time bomb. Because as we know, rheumatic heart disease is a monster. It loves biting the heart, and once the valves are affected, it is irreversible. Thank you.
Okay, thank you very much, Doctor, for that addition. We need to take note. Yeah, he told us to embrace the parish development model to fight poverty, because as we have seen, most affect people with low socioeconomic status. With that, I think that concludes the risk factors and the causes of heart disease in children. With that, we shall break off for a short time. Then when we come back, we'll talk about how this patient present, how can we identify that this patient has heart disease. Thank you very much.
You are watching the DOCtalk Show. This message is from the Ministry of Health with support from partners.
Looking for instant excitement? The Uganda National Lottery Spin for Cash game is now available online. Wherever you are, you can join the excitement for just 500, 1,000 and 2,000 Uganda shillings. Don't miss out. Register now on www.nationallottery.go.ug for a chance to win your share of 2 billion instantly. What are you waiting for? Play Spin for Cash now, anytime, anywhere. Ituba is the proud operator of the Uganda National Lottery. Uganda National Lottery. Dream, play, win. Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Ituba Uganda and regulated by the National Lotteries and Gaming Regulatory Board.
You are watching the DOCtalk Show. This message is from the Ministry of Health with support from partners.
Good evening, viewers. Welcome back from the break. So we have talked about what are these heart disease in children, what causes them. Now we want to see how do you identify, how do these patients present, how can the worker know, how can the parent know that the child may have a heart problem. And with that, I'll invite Dr. Agatha to take us through that. Dr. Walker.
Thank you very much, Dr. Afizi, and thank you, dear viewers, for staying with us. I'll talk about the presentation of children with heart diseases. How does this child present? What we call the signs and symptoms. So to start with, I'll start with the newborn babies. If a child is born too soon, the preterm, the prematures, they may not show these overt signs, but have a high index of suspicion because of the risk that they're at, like Dr. Tenywa had earlier mentioned. However, newborn babies may have difficulty breathing as soon as they are born because of how the systems change. When the baby is in the womb, they're depending on the mother for oxygen through the mother's blood. So when they're born, their systems should adjust in that they should breathe and have the heart support them by themselves. So they may have challenges adjusting to the outside environment. So these babies could have difficulty in breathing to the extent that some of them will need to be bagged, to be resuscitated. They may be blue when you check their lips, their palms, and even sometimes their skin could turn blue. They may have difficulty in breathing or fast breathing. These are some of the signs we could notice in the early newborn period. Then going forward, the child could have difficulty feeding, that when they are breastfeeding, they cannot breastfeed for long minutes. For short intervals, they breastfeed for short intervals. They easily get tired because breastfeeding is an exercise to a newborn. So they get tired on feeding. Sometimes they sweat a lot. Sometimes the breathing becomes worse because of that exercise of breastfeeding. And then we notice that the child could fail to thrive. They have poor weight gain. That a baby who was born probably at about 3.5 kilograms, by 5 months they're just weighing 4 kilograms, that the baby is not gaining weight well. That could be another sign. These children could also get repeated chest infections, the pneumonias. So if a child is getting recurrent pneumonia, especially a child who has well been vaccinated, you should have a high index of suspicion for a congenital heart disease. As the child grows older, you could realize that this child easily gets tired when they're playing with their friends. They cannot run for long periods, they get tired. They are just weak children. They sometimes also get unending cough when they're sleeping down. They get difficulty breathing. So these are children that we need to bring forward to evaluate for a possible heart disease.
Yeah, I wanted to also add on, for bigger children, the child can tell you that I feel like my heart is racing, palpitations. So that one is very key. And the other thing, when they go to play with their peers, others can squat. They play then they squat. Then some of their peers even can slap them. Why are you over squatting? Or even when they are walking, they get tired, they sit down, and most mothers call them, oh, father, these are slow children. These children are so slow. They are so lazy. They are sluggish. Okay? Yet actually the child is having a heart problem. Others actually can even collapse. Syncope. They can collapse. Others can even become unconscious. Others even just when they go to, when they laugh a lot, like children who have tetralogy of Fallot, they are blue, and when they laugh a lot, you see them collapsing or becoming weak. Okay? So these are the things we should take serious. Just like Dr. Agatha has said. Yes. Thank you.
And some of these are actually, they could actually present to the health worker for another problem. Maybe the child has a fever, has malaria, and as you're examining, you notice some things that could point to a possibility of a heart disease. Sometimes you see the side of the chest where the heart is found is visibly, like you see the heart beating through their chest. Some of them you realize the heart beats so fast, and there could even be abnormal sounds called murmurs. As you're just checking for, probably you're listening to the chest for pneumonia, and then you feel there is some abnormal sound in the heart. So some of these patients, we call them incidental findings. The child came for something else, and then you realize they could actually have a heart disease.
Thank you for that. I think that we, as health workers, we need to pay attention to details. I believe also these children, so they can involve swelling of the body and legs and all that. So we should pay attention to details with these children. Mean that, like they told, the child tells you he feels his heart racing, the child tiring, because we know children are supposed to be active. Therefore, we should look out at that as and as also parents. When you find a patient has any of that, visit the hospital, like Jinja hospital. You can come to hospital. We can assess the child and we're able to advise or to investigate, because we're able to do the echo, to look at the heart itself, and be able to tell whether the child has a heart problem. And I think this needs to be done as possible, because doctor said even these kids can end up suddenly die. So you can avoid this. So we call upon parents, health workers to pay attention to details and look out for these features of heart disease in children, both acquired and those who are born with the congenital. I think with that, I need to thank you viewers for following us, and we shall go for a small break. And when we come back, we shall look at how do we manage it? How do we, first of all, confirm the diagnosis, and then how do we manage these patients, and how do we prevent that from happening? Thank you.
You are watching the DOCtalk Show. This message is from the Ministry of Health with support from partners.
This week on UBC.
President Yoweri Kaguta Museveni has long advocated for markets as a starting point for low-income earners looking to learn the basics of business.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Good evening, viewers. Welcome back from the break. And also thank you for staying tuned. Now we are going to talk about how do we make a diagnosis, how do we make a diagnosis and confirm a diagnosis of heart disease in children, and then after making a diagnosis, how do we treat these children? Because one thing to diagnose, but another thing treating them, then we shall talk about their prevention. So with diagnosis, I'm going to invite Dr. Agatha to take us through how do we make a diagnosis in these children who have heart disease. How do you confirm that it's really heart disease, not any other thing? Yeah, Doctor, welcome.
Thank you very much, Dr. Afizi. So for diagnosing congenital heart disease, really starts from taking a very detailed history. If a person comes to you, child comes to you, taking a detailed history, going as far as the pregnancy, the mother, even the period before conception of this baby, and the events that occurred, the illnesses they might have suffered, the drugs they might have ingested in that period, and then the delivery period, how the first month was, and then how the child has been growing. Like we had earlier talked about the way these children present. So we're going to pick that from history. And after that, we go on to do a detailed examination of this patient, whereby we look at the signs, the pointers to a possible heart disease. It starts all the way from the lips, the color of the lips. We look at the fingers, whether they are curved or not, what we call finger clubbing. And then we'll look also for features of heart failure, because having a heart problem could predispose you to heart failure, whereby they could have swelling in the legs, what we call edema, their breathing rate, because a problem on the heart can actually affect the breathing. And then also you calculate, you count the heart rate, the pulse rate. And then we go on to specifically examine for the area of the heart, the chest, how it's beating, how the heart sounds, and any abnormal sounds. So doctors, we could tell sometimes from the signs and how the heart sounds, you could have a suspicion of a particular heart disease, but it does not confirm. Then we go on to do some more advanced tests, like what we call the ECG, the electrocardiograph. This one is like a print of the electrical activity of the heart. And from that electrical activity of the heart, you could as well have pointers to particular heart diseases. You could as well do imaging. This includes a chest X-ray. The chest X-ray looks at the size of the heart, the shape, and the surrounding areas, which include the blood vessels of the lungs, which could as well give us pointers to particular congenital heart diseases. And then the more diagnostic one is the cardiac echo, which is the scan of the heart, what we call CATV. They put things on the chest and look at the heart. This one directly sees how the heart looks like, the rooms that we talked about, the 4 heart chambers, how they work, the size, and any communication, abnormal holes in the heart can be picked from this scan. There's another more advanced test which can be done within theater, which is called cardiac catheterization, where they are able to directly look at the heart. I will not talk much about that one.
Thank you, Doctor. So Doctor has told us how we come up with the diagnosis history. Therefore, we need to understand who our patient is. Then we examine our patient. Then there, we're able to ask the appropriate investigation, as she has taken us through that. With that, after now making the diagnosis, the next action will be treatment. How do we treat this patient? So I'll invite Dr. Tenywa, who is our cardiologist, to take us through how best can we treat a patient we have diagnosed with the heart disease in children. Doctor, welcome.
Thank you so much, our dear viewers, and thank you for staying tuned. Management of heart disease, we have to start with our mothers who have these babies, because they're the ones who will see the signs and symptoms and they'll take them to hospital. Now, when they take them to hospital or any health facility, they will come in touch with the health workers. So it's like what Dr. Agatha was saying. The health worker will ask our patients or the mothers or the children some questions. Okay, after, so they will be examined, and once they suspect a heart problem, then the investigations will be requested, which she has mentioned. I will not go into that. Now, how do we manage these children? So I'll start with the congenital heart disease, the heart diseases which are born with, babies are born with. So if you look at the congenital heart diseases, we also classify them. There are those ones which are mild, and there are those ones which are complex heart diseases. Complex heart diseases, life-threatening. Okay, they are life-threatening if you don't urgently intervene. So for mild heart diseases, an example is you can have like a hole in the heart, but when it is small. Okay, so sometimes we do what we call medical management versus surgical. So there are many children actually who are on just medical treatment and they are just on follow-up, because some holes actually do close. There are babies who are born too soon, like the preterm babies who are born with the patent ductal arteriosus. But as they grow, within even 3 months, some of those small holes have closed. But obviously that follow-up is done by doctors who have specialized, like pediatricians, okay? Even doctors, heart doctors, okay? Not every person can follow up those babies. They need to be actually in a regional referral hospital, national referral hospital, or a heart center. For Uganda, we have Uganda Heart Institute. Okay? So those are the children who should be managed at regional referral hospitals, national referral hospitals, or heart centers in Uganda, because they need close follow-up. Okay? In case of anything, you can advise them on what to do next. So for small holes, most of them, by and large, they don't need surgery. They close medically. But obviously, they should be under the close follow-up of specialists, like physicians, like pediatricians, like cardiologists, heart doctors. Now, there are heart defects which are complex, whereby if you don't intervene, you lose the child. An example is like for small babies, when they are born, there are conditions we call severe coarctation of the aorta. The baby will come with shock, will become unconscious, unrecordable blood pressure, okay? And you may think the baby is having infection, what we call neonatal sepsis, actually when the child is having a complex heart disease. There are other complex heart diseases like tetralogy of Fallot, truncus arteriosus. I don't want to go through that, but I'm just listing them. Transposition of great arteries, the total anomalous pulmonary venous return, hypoplastic left heart syndrome, all those, they need close follow-up, and they should be referred from lower health facilities to a center which has a heart doctor, the so-called cardiologist, who will re-evaluate the patient and will repeat the heart scan, and some of them might need a combination of both medical and surgical. Okay? Now, some of the surgical modalities, there are those which are curative and there are those which are palliative. Okay? But I will not go into the details of the palliative shunts and the curative. But by and large, most of the heart conditions can be handled at Uganda Heart Institute for those ones which need surgery. For example, if the child has a large hole, how do you know that the child has a large hole? Will not put on weight. Failure to put on weight, they will take long to crawl, take long to walk, take long to be active, excessive sweating even while feeding. They get tired while walking. Okay, so those ones normally what we do, they need open heart surgery, and we normally refer them to Uganda Heart Institute, which will do the definitive curative surgery. So there are so many different surgeries we do for each heart condition, which I don't want to go into detail. But by and large, once we identify it at regional referral hospitals, some of them can be, actually 80% are managed in the regional referral hospitals medically by a heart specialist. However, there are those that need surgical treatment, and normally those ones, we send them to Uganda Heart Institute, which is the national center which deals with heart patients, be it adults, be it children in Mulago, and they handle it perfectly well. Okay, and when they are worked on in Mulago, still we can follow them up from the regional referral hospitals. Now, for the acquired, like rheumatic heart disease, where the valves are eaten, still you can have rheumatic heart disease, but when the valves are just mildly affected. So those ones, normally we give them some prophylaxis. There's an injection we give them every month on the buttock. Every month we give them an injection of benzathine penicillin to prevent recurrence of sore throat, which will further worsen the valves which are already damaged. So, for example, if they have rheumatic disease, but the valves were mildly affected, then they need close medical follow-up. Okay? But if the valves are severely affected, we still give them the medical management, but sometimes they need replacement of the valves, or they might need repair of the valves for them to have good quality of life. Thank you.
Okay, thank you very much, Dr. Tenywa, for that. In summary, you have told us treatment really for both medical and surgical, for both acquired and congenital heart disease. But all this, we have confirmed that also in Jinja Regional Hospital, we can follow them up. And with that, also in your hospital, we are able to do also open cardiac surgery here. That means that with this improved capacity building, we are able to do this. And I need to inform the viewers that as the hospital, Jinja Regional Hospital, I think in the month of May 2025, we are going to have a second open heart surgery at Jinja Hospital, still in collaboration between Jinja Hospital and Uganda Heart Institute, as a follow-up of the previous one we had last year. Last year we had 7 operated. This year we hope to operate many. Therefore, hospital still is open on ongoing screening for patients, for children with heart defects who will benefit from this open heart surgery. But before I close, I need to invite Dr. Tenywa just for about few seconds, tell us what are some of the key preventive measures for these heart disease children. Dr. Walker.
So thank you, Dr. Afizi. Maybe I want to say something about open heart surgery versus closed heart surgery. So right now for Jinja, we are doing actually closed heart surgery. We have not yet started doing open heart. Open heart, you put the patient on cardiopulmonary bypass. Okay. So normally, right now, what we are doing in collaboration with the Uganda Heart Institute, we are doing the closed heart surgery. Okay, like the patent ductus arteriosus ligation, okay, but we have not yet reached the extent of doing the open heart surgery. Yeah, so that one, I think we need to get it clear. So the other thing that I wanted to talk about, at Jinja Regional Hospital, we have the machines that can diagnose heart disease, both for children and adults. So we have the machines, we have 2 heart scan machines in Jinja Regional Hospital, state of the art, and we have 2 ECG machines, state of the art, in Jinja Regional Hospital. So everywhere you are, if they are suspecting a heart problem and you are stuck, our gate is wide open. You come, and we look at your heart, and we shall be able to advise you accordingly on what to do. So back to prevention. Now, if you look at prevention, we have what we call primary prevention, secondary prevention, and tertiary prevention. Now, primary prevention, there is what we call preconception attending, there is what we call preconception clinics. Okay? If you listen to the obstetricians, gynecologists out there, the talk of town is preconception care. Now, what is preconception care? If I'm a mother and I've ever suffered, if my baby, the firstborn maybe has a heart problem, that is the mother who should go to the obstetrician and gynecologist for preconception care. Now, what is preconception care? Before you get pregnant, you go to the obstetrician and you have a discussion. Musao, my first baby had a heart problem. I'm worried. What will happen to my the next pregnancy I want to get, the planned baby I want, the planned pregnancy I want to get in the next 3 months? So you sit with the obstetrician and you will take a history. If you may, for example, you've been taking cigarettes during pregnancy, maybe if you are taking alcohol the previous pregnancy, maybe you missed taking folic acid, maybe you had maternal diabetes, Maybe you had maternal gestational high blood pressure. Those are the things, you were epileptic and you were on a drug like sodium valproate, which predisposed the first baby to get heart disease. Then you'll have a discussion with the obstetrician so that you prepare for the next pregnancy so that we reduce on the risks of congenital heart disease for the subsequent pregnancies. Now,
UBC, inspiring Uganda.